This week on Healthy Living, what is sudden cardiac arrest and how can someone survive? Sports cardiologist Dr. Ankit Shah has some answers. And a new subvariant of COVID appears more transmissible, but observers say there is no need to panic. Plus, the UN says over 7 million children and youth died in 2021. Finally, cerebral palsy does not stand in the way of a young man in Virginia. We'll have these stories and more in this edition of Healthy Living. Hello and welcome to Healthy Living. I'm Lina Ahmoudou. As the heart beats, it pumps blood throughout the body and supplies oxygen. A sudden cardiac arrest is a medical emergency. Different from a heart attack, experts say a sudden cardiac arrest happens when the heart malfunctions and suddenly stops beating. A heart attack is when blood flow to the heart is blocked. According to the American Heart Association, about 90% of people who experience a cardiac arrest outside of the hospital die. Cardiopulmonary resuscitation, or CPR, increases the possibility of surviving a sudden cardiac arrest. Research showed that the global survival rate of out-of-hospital cardiac arrest for patients who received CPR has increased in the past 40 years. A higher survival rate after the medical emergency is more likely among patients who receive CPR and who live in Western countries. Last week, Elvis Presley's daughter, 54-year-old Lisa Marie Presley, died after suffering a cardiac arrest. On a more positive outcome, American athlete Damar Hamlin was released from the hospital and is now home more than a week after he went into cardiac arrest. Here is more.
Earlier this month, American football player Damar Hamlin collided with player T. Higgins during a game. A few seconds later, the Buffalo Bill player laid motionless and was surrounded by medical personnel and stunned players. The 24-year-old athlete suffered from a cardiac arrest and received CPR before being rushed to the hospital by ambulance.
Mr. Hamlin suffered a cardiac arrest on the field, and it was promptly recognized by the Buffalo Bills medical staff, and that allowed for a very immediate resuscitation on the field. He was promptly resuscitated. It did require CPR and defibrillation, and at which point he was transported to the University of Cincinnati Medical Center, where he was met by Dr. Pritz and the trauma team, as well as our emergency medicine colleagues.
Cardiac arrest occurs when the heart gets out of rhythm and suddenly stops beating. The person stops breathing, no longer has a pulse, and may lose consciousness. According to the U.S. National Institute of Health, the incidence of sudden cardiac arrest increases with age, and older people are more at risk of sudden cardiac death. However, young athletes can suffer commotio cordis, a blunt trauma to the chest resulting in irregular heart rhythm and often leading to sudden death. Hamlin survived his medical incident and has been discharged from hospital, as doctors continue to try to pinpoint the cause of the cardiac arrest.
He appears to be neurologically completely intact, and there is no reason to believe that he won't continue his path to recovery.
Researchers say sudden cardiac death remains a leading cause of mortality around the world and accounts for up to 20% of death in Western societies. Populations in low and middle-income countries carry an increasing burden of cardiovascular risk factors such as obesity and high blood pressure, placing them more and more at risk of sudden cardiac death. Experts say treatment within the first few minutes of a sudden cardiac arrest, such as administering CPR, is vital and can save the person's life.
So what may cause a seemingly healthy person to have a cardiac arrest? And to what extent is a cardiac arrest different from a heart attack? Joining us in the studio for more insight is Dr. Ankit Shah, a sports cardiologist with MedStar. Dr. Shah, thank you so much for joining us.
Hey, thank you very much for having me.
So we hear a lot about heart attacks, but cardiac arrest is something that has been in the news recently with the American football player, as well as Lisa Marie Presley, Elvis Presley's daughter, who also died from a cardiac arrest. So what is a cardiac arrest? How do we understand that as opposed to a heart attack?
So as a review, the heart functions as a pump, right? And so the pump, the function of it is to send blood, which is oxygen and nutrient rich, to the rest of the body. To the heart, to the brain, to the kidneys, to the muscles. And so in cardiac arrest, it's essentially an abrupt loss of heart function. It's typically caused by an abnormal heart rhythm called ventricular fibrillation, and where the heart's quivering. So normally the heart beats as a synchronous thing where it's squeezing in a synchronous fashion, and then the blood gets transferred to the rest of the body. In ventricular fibrillation, it's just quivering, and so the function is essentially lost. And then the organs don't receive their oxygen and their nutrients, and if you don't act within a few minutes, it can lead to sudden death. The difference with heart attack is that's actually a heart artery problem, and so the heart also needs oxygen and nutrients to function to become that pump, and so it has coronary arteries, and so when you have a blockage in one of those arteries, that can lead to a heart attack. So a heart attack can lead to a cardiac arrest, but they're two different things. So in terms of prevention of cardiac arrest, there's a few things. So for someone I would split up to two categories, one with people with known heart disease and one with people without any heart disease. So if you go to the latter group first, so someone who has no heart disease is to really live a good, healthy life. So avoid the smoking, avoid drugs, make sure you're seeing your doctor regularly. So if you have high blood pressure, high cholesterol, or diabetes, that's treated, that's acknowledged. You try to exercise, actually 150 minutes a week of moderate exercise. That can be brisk walking. It doesn't have to be marathon running. It can actually reduce your risk of having a heart event. And then the other category is people with known heart disease. So either you have a genetic heart problem or you've had a heart attack. Working with your physicians to make sure all of your risk is as best controlled as possible. And then in certain conditions, there actually is a recommendation to have a defibrillator placed, an ICD, implantable cardioverter defibrillator placed to protect you from that risk of sudden death if you are higher risk. So if you see someone that collapses and they're unresponsive, you want to call 911. And then if there's multiple people, you want to ask someone to get the closest AED. And then if you know how to, start CPR.
AED being?
Automated external defibrillator. And so usually every public place will have it. And so you can either call an employee nearby or look for it. But that's if you have a second person. And then the first person goes to the person who's collapsed and starts CPR if you know how to do it. That's chest compressions on the chest, about 100 to 120 beats times per minute. And then as soon as you get that AED, that defibrillator, you want to apply it and let it decide if it needs a shock. We know from data that for what we recommend for athletes now is that you try to get that defibrillator on and deliver a shock within 3 minutes of a collapse if you can. And that's because the data that we have essentially suggests that every minute of delay in the shock reduces the chance of survival by 7 to 10%.
South Africa's Ministry of Health says it does not see the need for now to implement any new COVID-19 restrictions in the country or for travelers despite rising cases of the XBB.1.5 Omicron subvariant of COVID in other parts of the world. South Africa detected its first case of the COVID subvariant last week, and public health experts say there are certain characteristics that make the new strain more transmissible. Most cases of XBB.1.5 currently come from the United States, the United Kingdom, and Denmark. The African continent has recorded over 12 million cases of COVID-19 as of today, and 95% have recovered, according to the Africa CDC. Meanwhile, China has reported a huge rise in COVID-related deaths. The country's top health body, the National Health Commission, says nearly 60,000 COVID-related deaths have been recorded in hospitals since December. The country has abruptly dismantled its zero-COVID policy in early December. Over 90% of the patients who died were aged 65 and older. The number of daily hospital visits peaked at 2.9 million in December 23rd and had fallen 83% to 477,000 by January 12th, according to the country's National Health Commission. A new UN report says at least 5 million children died before they reached their 5th birthday. Another 2.1 million children, adolescents, and youth lost their lives in 2021. The report reveals that equitable access to high-quality maternal, infant, child, and adolescent health care could have prevented these deaths, and the birth location of a child determines its life expectancy. More children and youth died in sub-Saharan Africa and Central and South Asia than in other regions of the world. While the global average of under-5 mortality rate in 2021 is 38 deaths per 1,000 live births, it is 74 deaths per 1,000 live births in sub-Saharan Africa. Respiratory diseases, diarrhea, measles, malnutrition, malaria, and newborn conditions are among the top causes of death of newborns and children under the age of 5. But there is some good news. The under-5 mortality rate decreased worldwide by more than a third. Cerebral palsy is a group of disorders that affect movement and muscle tone or posture. It's caused by damage that occurs to the immature developing brain, most often before birth. VOA's Marsha James brings us a heartwarming story about Adam Tubin, whose severe form of this disease does not stand in the way of being a customer greeter and social media director at an ice cream parlor in Virginia. Take a look.
Math grade 2. Math grade 4.
Is this what you want now? Is this all right?
Yeah.
All right. Go ahead.
Wake up. Mouse 9. Mouse click.
Most of us use a mouse,
Math grade 2.
and we just move the mouse, and we do an immediate click, and whatever we want to show on the screen comes up. What you're seeing Adam doing is the same thing, but using his voice and not his hand to move a mouse. And you can see all the different steps it takes to accomplish what we can do in one swift motion.
Today, I will show you how I do social media for Jake's Ice Cream in Falls Church, Virginia.
Right now, Adam's looking at an email message from Robin with 3 attachments. They're different cupcakes. So Adam now is going to
I'm gonna post
them.
I'm gonna post them online right now. I post on Twitter, Yelp, Google Business, Facebook, and Instagram for Jake's Ice Cream.
Most of the people that come in here understand that we are a shop that hires primarily people with disabilities. We have very few people without disabilities that work here, very few. They range in age from 18 to 46. For my entire career, I have worked with the special needs community, with stroke patients, with people with mental health issues, people with learning disabilities, people with head injuries, that has been my passion before I had a nephew that had special needs. And I opened the ice cream parlor specifically for my nephew Jake and other people like him. So this is a for-profit business. It's not a not-for-profit business. So we can't take donations here. We have to earn what we're doing.
Enjoy, thank you.
We don't have a job description here. We expect the kids to learn how to do just about everything. I don't care what their disabilities are. If they can't do it, then a buddy can help them with it.
All right, I'm gonna get with Adam.
Have fun.
You just Facebook and Instagram together, but you can do that already.
Okay. I like what I do because it makes the day go faster. Plus, it makes me feel good because I can do something in the world. Enjoy, thank you.
That's our show for today. For more health news, wellness tips, and medical breakthroughs, stay connected to Voice of America at voaafrica.com. You can follow me on Twitter at Linor Moudou. Until next time, stay well and strive to make every day a healthy day.